Welcome to the Halifax Health Physician's Desktop Overview. In this video, you will learn how to navigate the user desktop, utilize MEDITECH for physician documentation, including the editing of draft documents, enter your PIN number and save signed documents, and lastly, sign documents and orders. Let's begin by learning how to navigate the physician desktop. Upon logging into MEDITECH, you may be prompted to sign any pending documents. For this portion of the video, we will choose No, which will bring us to the default view, the Physician menu. When viewing the Physician main menu, we will be presented with several options. For this video, select the Physician desktop. This default view is your rounding list for inpatients, which includes patients you are attending and those you have selected for rounds. Notice the icons to the left column of the list. You can click on the magnifying glass to navigate the patient's EMR, or the pencil icon to enter the documentation routine. We will cover this routine later in the video. You may choose to change the list of patients by selecting the top and side buttons. The current selection, Rounding, is indicated by the white button at the top and Inpatients in the side buttons. Select My Admitted to narrow the list to just patients associated to you as the attending physician. Selecting Discharge List, patients associated to you and discharged within the last 7 days. You can also select Outpatients from the Side Buttons menu. This will list the patients associated to you if applicable. The side button for Emergency takes you to the ED tracker where you can view the patients currently in the ED. The Any Record side button gives you the ability to find any chart. You can search for a record by entering any of the following: name, social security number, EMR number, medical record number, account number, among other options. The preferred method is to search by account number. Remember to include the prefix when typing an identifier number. You may search by name by entering the first few characters of the last name followed by a comma. When searching by name, be sure to include the first few letters of the first name in order to avoid getting an error message for too many records on file. Click OK, and a list of all inpatients starting with those characters will display. The EMR and documentation icons also appear here. Utilize the Next and Previous Page buttons to navigate a long list. Adding a patient to your rounding list is accomplished by clicking on the name to highlight the patient, and then clicking on the Add Record to Rounding footer button. Use the back button to return to the search window. Click back to return to your original rounding patient list. At the bottom of the screen, you will notice the button Print List is displayed. Clicking on this button will print your current rounds report. Also at the bottom of the screen, you will see the cover selections. Clicking on this button will bring you to a list of the providers you are covering for. You may add other providers by searching by last name and selecting them with a click. Note that their name now appears in the selected providers list. Click OK and return to the desktop. We see that covering Dr. Harrington brings a new patient to our list. Another feature we find in the side menu is the Sign button. Selecting this will take you directly to your list of documents needing to be signed. This is called your sign queue. Now that we understand the basics of the physician desktop, let's review the documentation features, which will include saving a draft document, how to correctly use your PIN number, and saving signed documents. From your rounds list, click on the pencil icon to access the document routine. Note that the EMR panel buttons are accessible for your patient here. A list of documents for that patient will display along with their status. Choose Enter New button from the footer button to create a new document. To find a progress note template, begin by typing PR to search the list of templates under the All tab. As an alternative, if you have saved any commonly used documents as a favorite, you may access them under the Favorites tab. To add a favorite, select the template to highlight in green, then click the Add Favorite footer button. Double-click the template or click OK to open. You may enter a subjective remark or choose the Objective tab to open this section. Continue by entering an introductory note. You may insert results such as the 72-hour progress note by clicking on the Results button. You have the ability to enter canned text to the objective remarks. To do this, simply click your cursor where you desire to locate the canned text. Click on the Text footer button to search for Family Medicine Objective Note, double-click to select it. In the footer of this section, you can click OK to return to the main documentation screen, or click OK and Next to move to the next subsection. In this instance, it brings us to the medication subsection. Enter free text as appropriate, or utilize the Can Text Footer button option here as well. When the Can Text option has been used, notice the Undo button is available to erase any information if desired. Clicking OK Next brings us to the section in this template for Assessment and Plan. Type in the immediate plan. If you have completed all your documentation, click OK. To see how the document will display in the EMR, use the Preview Footer button. Clicking on the blue section header will take you back to that section for editing and entering more Can Text. Use the Return button to return to the template. You have two options for saving documents. You can either save as draft or save the document. We will save this document as a complete report using the Save Footer button. At the bottom of this screen, answer the prompt for status and click Save. If you selected Signed at the status prompt, you must enter your PIN and press Enter or Return to file your completed document. In this last section, we will learn the steps used in selecting the signing documents and orders from your sign queue. Upon logging into MEDITECH, you may be prompted to sign any pending documents. Answering yes to this prompt will bring you to your sign queue. The list of unsigned documents is shown with all selected, indicated by the check mark in the left column. Note that the right column for signed is blank for each document. You can deselect individual items or click on the top check to either select or deselect all. We will select all. Documents will present for your final review. Click the Sign or Next Footer button to go to the next document. Alternatively, you are not required to review the orders. Simply click on the Sign button, click Sign again, and then enter your PIN. You may at any time while reviewing the items use the Stop button to return to the list. The Edit button is also available for your use. If you have signed an error, you can highlight an item and click the Unsigned button to reverse it. The Signed Status column is now blank for that item and will be held for signing at a later time. Click Close to return to the Physician main menu. This concludes our overview of the Physician's desktop. If you have any questions, please contact Medical Informatics.